Welcome to Digital Wave Riders, a podcast where we unveil the hidden stories of business success from entrepreneurs and innovators, and how they engage in the digital landscape. This podcast is brought to you by NextWave Services, Charlotte's #1 web designer. Check them out at nextwaveservices.com. I'm your host, Brandon Cassiano. Let's delve into our next success story. All right, now welcome back to the Digital Wave Riders podcast. Today I'm joined by CEO of Alternative Living Solutions of North Carolina, Ms. Stephanie Morrison. How are you doing today, Stephanie?
I am awesome on this good Monday. How about
Good
you?
Monday. Stephanie, you, as I said, are the CEO of Alternative Living Solutions of North Carolina. Talk a little bit about your business. How did it come to be? What inspiration prompted you to develop this organization?
Okay, so I actually started off in nursing.
Mm.
And I've always was curious about what other way can people be helped in the community, because I always wanted to be in the healthcare field. So I started off in nursing. I'm like, whoa, this is getting to be too much. So, it was cool. You learn the experiences and the different types of clinical services that goes on in the nursing/medical field. So I happened to see a lot of people coming in that were homeless, because I did work on a dialysis unit. They didn't have a lot of resources for insurance, medications, housing, stuff like that. So I ended up, and plus, my own family too. Some of them had the same issues. Some were addicted to drugs, alcohol, mental health issues, all different types of things that cause them to be in a situation they're in.
Sure.
So we did have case management that the social workers provided at the hospital, but it was just enough to get them their case management and get them out the way because they need the room.
Yeah.
I'm like, maybe I can help people with resources, So I started off saying, how can I help people do more? So it actually started off as case management. HIV case management at that.
Okay.
So initially we were dealing with individuals that were HIV positive, and we provided HIV case management services, did it for like 5 years straight.
Yeah.
And how I got started with it, I had an uncle, of course, he was HIV positive, and we to like the last stages. So like, how could he been helped, before he passed away?
Yeah.
So we connected in the community. We connected with crisis, Section 8 housing, targeted unit housing. We connected with a lot of medical providers, mainly infectious disease, because that's what you'll see.
Oh, yeah.
Care facilities. And I started off making my own flyers. So I started off making flyers, printing them and say, hey, this is what we do. This is where we're located. Well, I actually didn't even really have an office. It was a shared space with someone I knew.
Okay.
So they let me use like a room in their office. Started off with that. Wow, I'm not getting called. I don't know what's going on. So every weekend I would just go out and put flyers, mail the old school way, put flyers in people's mailboxes. And it's like one day this call came through. I'm like, oh, we got a call. I'm so excited. So I remember when you guys were passing out the flyers, and I didn't want to say nothing on the porch because I had company and, all that stuff. They didn't want to, reveal, their status.
Sure. Yeah.
And it just went from there. And then next thing you know, they told someone else and they told someone else. And a lot of them couldn't afford to pay out of pocket. Next mindset was, how can I get connected with insurances, health insurance, like your Medicaid, Medicare, Blue Cross, stuff like that. So I had to do a little research, come to find out every insurance doesn't pay for that, but Medicaid did. And 90% of people were on Medicaid.
Yeah.
So I ended up learning how to get a network with the Medicaid plans that were, at that time, it was just MedLink. I'm not sure if you remember that. But it was just MedLink, and I got a network. It took a while, but we did it. So I had to cease seeing people until I got in network. So
Gotcha.
People, and then when we were approved to see people with Medicaid, then I picked it back up.
Mm.
So that's mainly how we started it. And
Mm-hmm.
then we eventually seen it's more to this.
Yeah.
I added another program, which is mental health.
Mm-hmm.
So we did the mental health counseling, well, we still do. That was maybe, like I said, between 3 to 5 years after the case management only. So I'm like, most of them have a lot of mental health issues that they need help with, which is probably why they're in the situation they're in.
Yeah.
So we added that program
Mm-hmm.
along with substance abuse.
Mm.
So that's all together. So now we have 2 programs with them. I'm like, this is working out good. So the people that were in the case management program
Yeah.
kind of getting dual services.
Gotcha.
So go on to say a couple years passed and we added non-emergency medical transportation.
Yes, that's awesome.
Because again, you have people that they can get on the city bus, but what if they have a walker or a cane or can't walk
Right.
that long, they're short of breath, or they have children, or they don't have the funds, or
Right.
stuff like that. So we end up getting a network through, again, our Medicaid providers, grants through the county, invested in vehicles. So we do non-emergency, taking them to their doctor's appointment, dental appointments,
Yeah.
picking up prescriptions, stuff like that. So I'm gonna take it another notch further. And then we also created home health.
Yes.
So we have home health now, and that's our
Mm-hmm.
newest program. Had the home health for 2 years now.
Ooh.
And of course, that's for anybody needing home health, whether it's an elderly parent, a sibling, a mother that stays at home and has a disabled child.
Yeah.
Respite care, needs
Mm-hmm.
sitter services. It's for all ages, all types. Someone leaving outpatient surgery and may need that extra care for a mom that's had a baby, and maybe dad can't stay the whole time that she's out, and they need somebody there until they recover. Stuff like that. So I included all of those programs. So if you're coming in the program, it's like a one-stop shop.
Yeah.
So you may need one program, and then later on down the road, you may need another, service. Later on down the road, you may need another service. And throughout all of that time, we've gotten a network with over, not just Medicaid, we said Medicaid, Medicare, Blue Cross, United Healthcare, EAP.
Yeah.
And I don't know if people know what EAP is, but that's a employee assistance program where we'll refer you and pay so many sessions. So we're multiple EAPs, of course, self-pay, I'm sorry. And then we're also in network with the Medicaids for transportation in a one-call service that's strictly workers' compensation.
Yeah.
So we do that as well. And we're also nonprofit, and we became nonprofit in 2016. It's still going. And we are also accredited now as of last November.
Very nice. Now,
So,
there's a lot. There's a lot. So in that expansion process, what did the acclimation look like? You're adding all these new programs onto the organization to be able to have a hand and expand into all these needed areas. But what did that look like? You decide, you realize there's another area you've got to be able to be involved in, but then that's also adding this kind of larger field into the vision of the business. So was there like an assimilation or like an acclimation process when you added those new elements in? What did that look like?
Oh yeah, absolutely. So for each program, you have to meet the state requirements. For your home health, you have to do the application process. Headache. You have to provide your policy and procedures. You pay that North Carolina state fee, and then you have to do it every year. And you choose the counties that you want to serve.
Gotcha.
The same with the non-emergency medical. You have to have your vehicles inspected, go through the application process, get all of your driver's credentialed, run background checks.
Yes.
Getting in network with the insurance, you got to keep them renewed every 3 years. You got to do the drug testing. And when they do your audits, they want to see all of that. So it's background part is like a lot of sleepless nights. You got to get it done. You got deadlines, and it's to meet the requirement, your state requirements. And you just got to do what you got to do to make it happen.
So for anyone who has yet to hear about ALSNC until now, seeing the show and they're wondering, is it worth to reach out, because I don't know if they service the area. So what is the expanse of ALSNC? What counties are you guys operative in?
Oh, great question. So Mecklenburg County, Gaston County, Cabarrus County, Rowan County, Union County. I feel like I'm forgetting a county.
Iredell?
I know it's like, I believe so, Iredell. So, and with counseling, you could be anywhere because we do virtual.
Okay, cool.
Only thing we can't accept worldwide is Medicaid.
Gotcha.
But if like your Blue Cross, your Aetna, your United Health, or self-pay, then you can literally do your counseling anywhere. And we have evening hours, weekend hours.
Ooh.
We have some great therapists. Even some of them see them on a Sunday, even though it's virtual.
Yeah. That is so cool that you guys are so involved. That is a fantastic operation you got going. So I know you mentioned the way you got that first call, you mentioned that was thanks to all the flyers you were doing out there. You're doing the old school marketing. So talk a little bit more about what that initial marketing path looked like. Obviously, you got the print marketing that you were working. And then once momentum started to become a thing for you guys, what did the development from there look like? How did that change for you guys?
Okay. I still do old school marketing. I can't help it. I still do old school marketing, but
yes. Well, talk about why you love old school marketing. What for you keeps you working with that rhythm of that marketing style?
Okay, for me, I like to engage the community.
Yes.
So I'm born and raised in Charlotte, of course, but although we're not like a huge corporation yet, I
love
just
that.
like people just don't know. They don't know what's out here. So if they see a face, they're like, oh, I've heard of that, but I didn't know. Oh, they get familiar with you. They'll open up and talk to you. Well, I know such and such need this, or that. And you could say, well, here's my information. Give it to them.
Yes.
And they'll say, can I call you? Can I do this? I do community events. I did plenty of with the county of Mecklenburg, with different sorority and fraternity groups, school colleges, high schools. Some of them need services as well. And then I also use my website developer. They have me a website going, and it does a little marketing too.
Yeah.
Online. So they help with my social media, put things on there because I'm horrible with that. I'm trying to get better with social media, but it's like I'm so busy. I'm like, I didn't post nothing. I haven't posted nothing in weeks or months. And
I get you. I get that so well. I do social media myself I have clients who I'm very, very consistent for, but I'm like, bro, you've got your own stuff that you barely do anything for. Like, you got to find the balance, man.
Yeah, so, you're right. The day goes like that. So
yes.
Like, I haven't posted in a month, and it don't even seem like a month.
Right.
So,
especially as busy as you are. Yeah.
Yeah, I'm going. But I love working with the people out in the community because even some companies don't even know. And I've gained relationships with medical providers where now they're comfortable with sending referrals. And they're like, hey, I know this person, you take this, they're sending referrals to me now. And then when I'm with the insurance companies, that's another automatic referral system.
Yeah.
When you're with certain EAP corporations, they're sending it to you via email, fax, or call. So they may say, hey, do you guys have any availability? You just may randomly get an email or, a fax or a call.
Yeah.
So we have referral forms that I've literally took myself to, and they'll use those forms and fax them over to me. So, or to my office staffs, and she'll handle them, call them back, and make sure everything's good with, insurance, availability, and get them scheduled.
Right.
So kind of both ways, marketing is like nonstop.
Yeah. 100%.
Always want to be involved. So even though I have the best marketing, which I have Google, I still have to have my hands on it.
Oh, I get
I
that.
know.
I get that so much. I love that. So
Yeah.
taking your when you kind of made that shift and decided, okay, let's do a website. Obviously, trusting a team to listen to you, discuss your business, understand the concept, understand the essentials, like what needs to be known, and trust this group to represent you in this digital landscape. What did that process look like for you? What were the initial conversations? What were the expectations? And how did that process look for you?
Oh boy, that was hard for me because I'm always in control, and I'm scared like, oh God, they're gonna get it right. Oh, they're putting that wrong, So, but they eased my mind, and we literally had a phone Zoom. And they were like, so tell me about your business. What do you do? Kind of like what we're doing. And
Yeah.
it's like, oh, I'm doing this. Then I think, second guess myself, did I leave something out? Did I forget to tell them something? So, I'm able to email them. And I had one person that I go to, which was the beauty of it. So I didn't have to be like, what's her name again? Or what's his name again? So I had that one go-to person.
Good.
And
very cool.
they would do a sample. Well, they would complete it, but I was able to look at it before they even made it. And if it was something I didn't like, wanted to change, add pictures, they helped me with logos. They helped me with like everything. And I'm like, oh, thank you. Because before starting out, I did my own from Yahoo Small Business.
Mm-hmm.
And I couldn't get it right to save my life. Like I would be on it for a month. I'm like, I'm gonna change this tomorrow. I'm gonna do this tomorrow. I'm gonna do that. The words are running off the screen. I'm like, no, that's not the format I want to use. I'm like, you know what? I need help. So you gotta lay things out to people and let that person do what they do and that person do, because it's not, you're running yourself crazy. But just stay in positions and making sure it's worth your while. Do your research. I say look at those ratings and don't be afraid to if something don't look right, don't be afraid to correct anybody. And it's not being, it's that it's your brand and you want it right.
Exactly. So that incorporation of you was really kind of your quintessential element to really finding yourself at ease with this process.
Absolutely.
So,
and I still add, like, you can still change things. Like I added my programs. I contact them like, can y'all add 2 more pages? Like, oh, what did you do now? They got so used to me. They be like, I'll change it. I got you.
That's like, so good.
Take this out. We doing this. They were like, oh boy.
You sound like a very fun client. So I'm not surprised that they enjoy working with you. But since the launch, how have you seen things change? What avenues has having that go-to space in the digital world unlocked for you as an organization?
Oh, speaking of that, I literally just got a referral through the website.
Oh, cool!
Right before it's a tool on my page where someone's looking for services. They can email you, and it goes your email with the phone number, email, all the good info. I'm like, So I had to send it to my office. I'm like, I can't call it now. I got to do this. I got to learn to take my hands off. So it works out really well because they can contact me through my website. And this is the beauty I love about it. I'm able to send out reviews from my website. So when somebody gets services, or if they even been in services for a while, I could just put their phone number in and then send the review, and they can do it on Google or the social media page.
Beautiful.
You have a new review, and you're like, oh, so I try to send those out weekly. And it's just a simple matter. And it's an app on your phone that they give you that's included. And you can just put numbers in, and it'll send it a link to their text message, and they click it and leave a review.
Gotcha. That's so incredible.
Yeah, that works out right.
So from here, seeing how everything has kind of progressed up to this point with the evolution of your presence, how you interact with people, how you've been able to expand and incorporate new programs, do you have any at the moment, any upcoming new plans, anything on the horizon for ALSNC that you would like to share through the show, or things that you have to hold off on and like surprise people with later?
Well, I'm always surprising, but we do. I forgot to mention that we do a lot of community involvement. So we do like back to school giveaways. Like now I have boxes of book bags in my office just sitting there, and we'll stuff them with supplies. So even if they don't need it at the beginning of the year, they could need it in the middle, summer school, camps, or whatever. We have it for them. We try to collect or get donations through Food Lion. Just gifted us $500 gift cards, and we give them to people who are new moves, elderly people who don't receive a take your gift card, get food, toiletries, whatever they may need. And we're also partnered with another housing company called the Targeted Unit Housing. So that's affordable. I'm gonna say apartment living, because when I say housing, people think it's an actual house, but it's apartment living.
Yeah.
And it's based on your income. And if you have SSI or SSDI, and it's another program they have, if you make $300 minimum a month, then you could qualify for the program. And we've helped this year alone, we've helped, let me see, maybe 200 people get housing.
Congratulations. That's so cool.
Based off of their income. So if they're only making $675 a month and they're getting an affordable house, their rent will be, it's a calculation. The last person I got placed in affordable living is paying $10 a month.
Wow.
No one ever lived there. So we out and year round incredible. We're always accepting donations for deodorant, washing powder, washcloths, household items, because when we have new moves, a lot of them are coming from the shelter, the streets, or another family, and they just don't have it to, move. So we're always accepting donations year round to help with the new move, even comforters and fitted sheets and stuff like that.
Yeah.
And it's for all, like, we've helped people from young as 21 to 90.
Ooh, wow.
So, yeah.
That is so good.
And it's putting them anywhere. They're really nice. The new ones that's coming up, nice area, nice apartment living. It's not going them anywhere. And so we also partner with wherever they get placed on housing at, we make sure they're in our program so they can sustain that housing.
Oh, very cool.
So we get familiar with the clubhouse people who work at the maintenance area, the clubhouse people, all that. So they'll know it's somebody here for them, because we've had people get put out because of mental issues. Something so small and it could have been handled, but they didn't have anyone to have their back to help them. So now they know to contact us if something's going wrong.
Absolutely.
Or if they're not paying bills or utilities, they'll say such and such didn't pay rent. Do you know what's going on with them?
Right.
And then we'll hey, what's going on? Then we try to find resources or whatever's going on. We're going to make sure it don't happen again, because we don't want them to go back.
That is amazing. Yeah. So what I love about you so far, sorry, go ahead.
Oh, go ahead. Good.
I was going to say, what I love about you so far is not only how you've chosen to position yourself in the front line of all these necessary medical and health needs for people who don't otherwise have those resources. But also, I love how when you started out, you let how you prefer and how you love to involve yourself with people guide how you went about building those initial rapports. So what I'd love to know from your perspective, for anyone else who's looking to develop an organization either in the same sphere as ALSNC or within any other kind of medical health sphere, what would your suggestions or insights be on what the groundwork for them should look like?
First, do what you love. Do
Mm.
what's in your heart. Don't let failure scare you. And what I mean by that, just because it's not working out in a year or two doesn't mean it's not working out.
Yeah.
That makes be disciplined
Mm.
more than anything, because some days you don't have a motivation. Some days you're like, you know what? Not today.
Mm.
I'm just not feeling it today. I don't want to do this. I don't know
Yes.
what people think it is. This is nope. You know, that's just like working out. You have a goal to reach. You know,
Mm-hmm.
days you don't want to do it. That's when you need to do it. Get up and
Mm.
do it. You don't get no sick days off. You don't
Right.
get to punk out. You don't get to cry and pout. You don't get to make excuses. You are responsible. And then as you grow, you're responsible for others.
Mm.
And they're dependent on you. So you don't get to cry like a little girl, a little baby. Oh, can you do it? You can. You can do it. It's the positivity. It's your mindset that you have to withhold. Like every day is a good day. Even on a bad day, it's a good day.
Yes.
A good day. And I had a lot of bad days where I just want to throw my hands up. And I've cried. I'm like, can't do it no more. I just can't do it. It got hard. But you know what? After I cried, I looked at myself like, are you kidding me, man? Please. And I'll get back to work. And like, I'm like, I got this. Yep. Hello. You know, I'm like,
Yes.
bruh, I'm just having one of them days where I don't want to do it anymore. But then when you it's okay to take that seat back and rest and just think, because when I'm not doing something, I feel like I need to be doing something.
Yes.
To be up. But don't deny yourself rest.
Mm-hmm.
Don't deny yourself that peace of mind. And I always say, find you an outlet. Like walking is mine. Whether you do it before or after your day in, or in the middle, or whenever. Walk, meditate. Just know it'll be fine. I get a lot of no's, a lot of them. A lot of no's, but guess what? All you need is one yes. That's it.
Yes.
That's it. So I go to stores and ask them, can I put, how if you go to a store, they're like, would you like to donate to the, juvenile diabetes or whatever? And I'm like, I'm trying to do that. Every store I told me, nope, 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 nope. You got to go to corporate. Nope, nope, nope. I'm still trying. So it's all good though.
Yes.
And don't be afraid to make mistakes. Don't be afraid to mess up. Don't be afraid to not know. Don't be afraid to network. Don't be afraid to go outside the box. Don't be afraid to do anything. Just be brave, be bold, and most of all, don't get complacent. Don't get comfortable.
Yes.
Because even though I have all these programs, I still feel like I have so much more to do. I do. Because one of my main goals, and I'll share it, I don't know when it's going to happen. I'm working on it. It's going to happen. I just don't know when.
I love that.
You can look back at this record like, she said that. But I do plan on creating affordable or temporary housing until people are placed in affordable.
Okay, cool.
So, because sometimes people have to wait, and you just don't know when their name going to come up. So, my goal is to create this residential unit, temporary, short term, until they're placed in housing. And while they're in there, they're going to get in this program, that program, and we're going to make it flow. So it'll be for all ages, like little cottages or whatever. That's my main goal.
Cool.
And I want to get that going. That'll be my last program. But, I'm in the research phase and the rules and regulations of North Carolina laws, blah, 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 and all of this stuff. So they're all my newly knows. So, and I want to continue to use my nonprofit to give back to the community and raise money for the uninsured. So if they're needing home health or counseling or both, I was doing a $1 a day campaign. $1 a day will help anybody with once a week counseling or something like that, which it does. Well, just believe it or not, we got seniors. Why you don't get Medicaid? I make $1 too much.
Yeah.
Yeah, too much so they can't get it. And, some they can't afford the affordable rates. They're already, barely paying their rent and other
Yeah.
stuff and stuff. So, I'm doing that $1 a day, and it'll help with anything. So I run that all year long.
Very cool. Well,
So far,
Stephanie, how can people find ALSNC, Alternative Living of North Carolina, Solutions of North Carolina? Sorry. How can people find it? Where should they look for you guys?
okay. So on Facebook, we are. Let me get the right name for you, because Lord have mercy. Facebook is it's Alternative Living Solutions Inc. And it's a picture of our building.
Cool.
That's the profile picture. I don't know if you can see it, but it'll look like this.
Gotcha. I see it. Very cool.
Okay, so that's the Facebook page.
Cool.
Then we have our Instagram. Again, I'm horrible posting, but I want to say it's ALS16. It's like that.
Gotcha.
Yeah. And I chose ALS16. That's the year we became nonprofit.
Very cool.
So, and then on our website, it's Alternative Living Solutions of NC.com.
All right. Well, thank you again so much for joining me this afternoon, Stephanie. This has been a great convo, and I cannot wait to share your business with the audience on Digital Wave Riders.
Awesome. Thank you for inviting. It was a pleasure.
All right.
And I really appreciate it.
Thanks for hanging with us on the Digital Wave Riders podcast. It was brought to you by NextWave Services, the leading company in web design and marketing in Charlotte, North Carolina. Check the episode notes to learn how you can connect with our guests or be a guest. Subscribe now or follow if you haven't already, and we'll see you on the next ride.